Hey everyone, welcome to the DarshanTalks podcast. I'm your host, Darshan Kulkarni. It's my mission to help you trust the people and products you depend on. I'm an attorney, I'm a pharmacist, and I advise companies with FDA-regulated products. So if you think about drugs, wonder about devices, obsess over pharmacy, now this is the podcast for you. And the reason it is because my guest is talking about drugs and devices and pharmacy all at the same time. So it's going to be a really fun conversation. I do have to specify I am an attorney, but I'm not your attorney. I'm a pharmacist. My guest is a pharmacist. We're not your pharmacist. So this is neither legal advice nor clinical advice. I do have to emphasize also that these are considerations and they do not necessarily reflect the opinions of the host, the guest, or their employers, or our clients. So if you like what you hear, please leave a message, please subscribe or share. You can always ask our guest questions as well. Just leave a comment. You can also reach out to us on Twitter at reach out to me on Twitter at DarshanTalks, or just go to my website at DarshanTalks.com. I do want to talk a little bit about our guest today. He is the president and CEO of HCI Healthcare Consultants LLC. It's a healthcare consulting group that's focused on helping healthcare organizations, hospitals, and health systems. Our guest for today, Tom Siepka. Hey, Tom, how are you?
Good, Darshan. How are you doing today?
Good to have you on. And so let's talk a little bit. Let's start from the beginning. You're a pharmacist who has his own consulting company. Yeah. As we all know, COVID has caused pharmacists to sort of rethink their careers. People are overworked. People are saying, I don't like what I do. You went a different path. What happened? How did you land up to where you are right now?
Well, I spent 30 years in healthcare, working. So I was about 16 years as a director of pharmacy, 14 years really more as an executive, where I was the senior vice president, chief pharmacy officer, or in a senior leadership position at the organization. So I did that. I went through the first COVID wave, still employed. I was in a major Boston teaching hospital and helped the organization survive that first wave of COVID, and a crazy time, I think, for all of us. I think the weirdest thing for me was driving into Boston every day with like no traffic, zero traffic. It was like a zombie apocalypse. But we did things that were amazing. It was one of those things that was the best of times and worst of times all the time. But we did a great job taking care of the people that we needed to serve. And so for me, thinking about your question, right? How did I end up in what I'm doing now and consulting? I did consulting a good 16 years ago or so. I did some consulting with a partner and did it for a period of time, but my kids were little. I decided to go back and get a regular job again. And I did that for the last, 14 years. And then all of a sudden, I said to myself, as things change and organizations grow, I think one of the biggest frustrations for healthcare leaders is sometimes the pace and type of change at organizations. And I said to myself, maybe it's time for me to do something a little bit different. I have a lot of experience in hospitals, healthcare systems. I'm a pharmacist, but done a lot of interesting things, and said, hey, let's work with a group. I partner with another group called Gates Healthcare as well. So I do a lot of work with them and have my own group, and it's satisfying and a little bit freeing, right, to do the consulting now, where I think the biggest change for me, being in healthcare for a long time, you always feel like you're going from fire to fire, dealing with an issue, putting out a problem, and then running to the next one, because there's so many things and challenges that come at you. I think in this space, you get to use your brain a lot more, right? You can be much more of a critical thinker. You're coming in to help organizations who are seeking assistance and ways to improve what they're doing. So it's very satisfying. I think it's really good for those healthcare providers that are listening, something you might want to do one day. It is a nice change, a pace to be able to do that, and then leverage all the experience I have and those that work with me to really help organizations and people. Because, being a clinician at heart, I still enjoy seeing improvements in patient care and those things. So we can do that, help an organization. That is really one of the big pluses about what I'm doing right now.
So you went through the first COVID wave, which I think is, and then you did it as senior leadership / chief pharmacy officer. Is that correct? Did I get that right?
Actually, I was chief pharmacy officer for that organization, and they actually pulled me out of pharmacy and had me help run logistics in the organization. So a little more of my leadership skills there. Ran supply chain, looked at, security reported up to us, facilities. Interestingly, not pharmacy. They had pharmacy go into a different group, the way our incident command structure laid out. But it was, again, it was a great experience. And even though it was very stressful, like we were going into circumstances we didn't know. There was a lot not known about the virus then, how it was spread. Do you need a mask? Not wear a mask? Is it droplet form? Is it touching things that get you sick? And we were working about 7 days a week for a few months. And just because there was that much to do and that many challenges coming at us, like every day, there was something that was almost unsolvable that seemed to show up into the logistics group that I was helping lead, and had great people around me that helped make that happen. But it was a tremendous experience. But it was also, I think, a key to me about my innovative skills, that all of the problems we got every day pretty much didn't have a solution. All the normal things that worked were broken, right? You just couldn't order something because it wouldn't come, right? And like one of our biggest challenges is we needed to, produce testing supplies for COVID patients, right? And you couldn't buy any COVID testing kits. So we actually had to create our own COVID testing kits. I had to create with the team in our group. So it's not just me, it's leading talented people that do amazing things. And we created, our own testing supplies, and we created our own assembly stations and produced several thousand testing kits a day that we supply not only to our organization, but to organizations within our health system. And it was doing things like that were hugely rewarding, during that process, but also said, hey, wait a minute. I still have that entrepreneurial mind that I had, good 16 years or so when I did consulting. Maybe it's something I should think about doing again. But yeah, it was great.
So you talked about this, essentially a trial by fire. A trial by fire, not only because you were in basically a time that we have never seen before. I'm sure someone saw it in the Spanish flu, but the fact is that most people of our generation have not seen that. But you pivoted as well at that same time into supply chain from pharmacy. First of all, obviously you rose to the occasion and you did it well. But was that movement at that time scary? And how does that reflect and compare to today, where you've now gone from being senior leadership in a hospital, a very reputable hospital, to running your own shop? And is that scary? How does that scariness compare, if you will?
Well, it's like different types of stress, right? There's good stress in this world and bad stress, right? So even though it was very stressful during that COVID wave, it was in some ways a good kind of stress because we were able to work with amazing people. So like when you said supply chain, I got the privilege of having our supply chain leader work with me as a leader of that logistics group to solve problems. And I was there to help guide that person, to say, like, let's think about the strategy. What do we want to do next? What are your challenges? I was trying to remove roadblocks and help, right? So it was doing that. And I think how it compares to the company, it's a similar thing where I don't know sometimes what each day brings, right? It depends what kind of phone call or email we get or who's looking for what kind of support to work on something. But it is the similar type of excitement where if you're working in a job and there, I had a great job, right? We worked with great people. But there's a certain amount of monotony with that, right? That there's like, you get a, keep the lights on, everything's going to run a certain way. And then some of the entrepreneurial things that we were able to do there really benefited the organization. We built out a farm corp, built out some amazing functionality within pharmacy, and it became one of the largest revenue producing centers for the organization and health system when we did that. So, that translates well into putting together a group of people that are seeking to go out and help people do the same thing in that particular case or improve in other areas. So So there's some alignments that way, right? So that excitement of going in, solving a problem, maybe not knowing what the problem is that might come in tomorrow. And maybe that's not for everybody either, right? So, some people like that, some people won't. But for me, I find that more exciting. That's probably why maybe they picked me to do logistics, because they saw, me working and building up the business and dealing with things that weren't known and be able to handle those. And I had some great partners in the work I did there that, I still talk to today. And, great people that helped make that happen, and translating that type of thinking out of the box, looking at ways to solve problems. And at the end of the day, similar to what I did before, helping people and helping organizations, that's really rewarding for myself and the people that are within my team.
So you talked a little bit about, well, you made a brief mention of this, where you said that pharmacy went to becoming one of the greatest revenue producers during COVID for the hospital. Yeah. I've always heard of pharmacy being a major cost center. Now, there's an appropriate reason why it's a major cost center, but are you saying that something switched, or are you saying that it's always a revenue generator? This just sort of exceeded the normal capability?
Yeah, so I think it's where, in being a 340B organization, right, is a driving factor there. And it was similar to another organization I worked for as a senior leader when I was at another large academic health system that I built out pharmacy for. But you're absolutely correct. Pharmacy is a cost center, right? So there are ICU beds and med-surg beds and medications and IVs and products that these people need, and those ambulatory clinics within those organizations. So there's major cost, right, for all those medications. And you have your clinical services, but the other side of the coin is the ambulatory side of pharmacy that I think, in my career has really expanded and blossomed in the last 10 to 15 years or so, where that has really become a big practice location clinically for pharmacists. So I think there's a huge amount of clinical impact that could be made there. But also what happened is, having pharmacy being seen more as an integral part of the organization, having the pharmacy leader be seen as a more involved member of the senior leadership team, leading an enterprise, we're able to leverage, retail and specialty pharmacy business that had left the organization historically, right? It was always there, just was never tapped into. And it went to organizations that do good work, right? But, the big names out there like the CVS's, the Walgreens, the Briovas, the Express Scripts, these organizations that service organizations, but maybe that organizations that aren't in healthcare, like, Ford Motor Company, they could be a good partner. But at our organization, where we had clinical capability, we had pharmacies programs, we opened up, and this was similar to what I did before in my other organization, opened up a retail pharmacy, opened up a specialty pharmacy, and then really expanded into that space. One of the driving things for leadership and myself was, it was one of the few businesses at the organization that not only did not lose money during COVID, but actually continued to grow during COVID. Where, other parts, when I was there in that logistics role, we shut down our ambulatory programs. We were turning ambulatory space into patient space. We were turning PACUs into ICUs, right? Because we were overwhelmed with patient volumes. So, the things that made money in the historical hospital model, right? The ambulatory clinics, the infusions, those visits, a lot of that got shut down. You only saw the most acute patients only that would come in. And the part of the organization that you try not to lose too much money on, that's DRG'd, right? That has set reimbursements for your hospital stay. We were bursting at the seams, but at best you try not to lose money there. And organizations really make their margin and really driven from outpatient procedures and these ambulatory areas that were basically shut down during COVID. So as luck would have it, we built our infrastructure out and had capability going into COVID. So that program continued to grow because people still needed their medications. They might not be able to drive to the hospital or go to the clinic visit, but we could mail out their medications to them. They didn't even need to come to our pharmacy. Our pharmacy was just as busy with almost nobody in the lobby of the pharmacy because we were mailing and sending everything out. So that was a really interesting thing, I think, for the organization to see from a diversification standpoint for pharmacies. Like, wow, this is something that really helped us during that. Because, I mean, you read about all the organizations that suffered financially as they went through these COVID waves because of what they had to do to service the community and the patients that they're in, that this pharmacy enterprise and business had some robustness to it, and that it actually helped the organization out significantly, during that time period. So, a big win for pharmacy as being a pharmacist like yourself, Darshan. I'm not a lawyer. So a regular
I'm with you.
Yeah, but it was good to see that pharmacy could be a factor, not only in patient care, but financial stability for the organization.
Which raises the question for me, which is, what you described is, for lack of a better term, the ascendance of pharmacy, which is great. That sounds awesome. My question for you is that, are the results you're seeing temporary then? Because our patient's going to come back, and that that means that the PACU that you took over is suddenly going to have to become a PACU all over again. Yep. And patients are going to come through the door, and you aren't mailing a pharmacy stuff over to them anyways. So do you think that those changes are temporary, or do you think that there's been a fundamental alteration in how we deliver services to our patients?
I think the PACUs and all those things have come back, right? I think the big change that's happened for organizations is the realization that there is some capability within telemedicine now to reach out and manage patients and interact with patients that was being utilized before, but not to the same degree. So you had a huge expansion, I think, in the telemedicine component that is dialed back a bit, but now I think has been legitimized, right? So people feel like maybe it was kind of convenient. Insurers weren't really sure. I mean, even before COVID, there was a lot of employers that said, I don't know if we can really allow remote workers, right? You got to come to the office every day. I think those things have changed quite a bit. So I don't think everything can be remote, like this works, right, as a podcast. But some things can be, and they can be very effective, meetings, patient interactions. For pharmacy, it was good that the ambulatory clinics came back as an integrated program, right, where our pharmacy and specialty was really reliant on the flow of patients from our clinics. So if those clinics forever stayed closed, it wouldn't be a robust business, really. But as those opened up, that kind of fed back into our program and how we got those patients to stay with us, because it's very competitive space, right? You can't outbuild a CVS or Walgreens or these companies that have, great locations, and it's a very good network, right, to take care of patients. We provided different, enhanced clinical services, specialty products like, talking scripts for patients that are visually impaired, compliance packaging, both in blister cards and like that pill pack box setup that Amazon uses, that type of technology for patients that are on a few medications and have a hard time managing their medications and taking them at the right times of day. So we did that, and we integrated lots of resources within the clinics directly. One of the best things we did as part of this is really developed a true ambulatory pharmacy program that the organization didn't really have before. So in building that out and hiring great people that led those people in those clinics, providing, I think, superior clinical services, patients were actually managed versus just filled for. I think one of the big challenges with the big boxes is that they're so spread out, so big. It's really hard for them to get individualized and really manage patients directly. They might argue that a bit, and they probably have instances where they do great work too. But just the sheer numbers, we tripped across many patients that were on astronomical amounts of medications that we cut down significantly. That the other company was more than happy to kind of ship out quickly and get that mail order to them as quick as possible, versus somebody saying, why is this patient on so many medications? So not only was it a success financially for the organization, but as you build these programs, such a great opportunity as a clinician and as a pharmacist to improve patient care, develop a relationship with the patient and the clinic and their leadership and practices. And we had huge advancements in collaborative practice agreements, pharmacists, authorizing certain prescriptions, through set algorithms and pathways that, that nobody was going rogue and like doing any crazy prescribing, but really moving pharmacists and pharmacy techs to top of licensure, which was awesome to see. And I think these are all like the secret sauces as organizations looking to get into the space. And some of the services that we can do sit at the table and plan this and strategize this. Like, just building the physical pharmacy is not enough, right? Saying, okay, we did some analytics, we ran some data, we know we have some value, we want to build a program. Just flicking an on sign on in the pharmacy is not going to make it happen, right? There's a lot more to it. And then, we talked a little bit, earlier, thinking about the effect of payers and PBMs in this space is a huge impact, right? Because a lot of these are closed networks, and those are challenges and strategies they need to develop. So there's a lot of hurdles there to jump through in building these programs, but the benefit back, I think, to the patient, our patient assistance programs blossomed hugely, right? Which is a core mission of a 340B organization, is providing benefit back to the patient. And we're able to do that and do a far superior job than what we did before through some of external partners we had, and also grow revenue, also do all these other improvements at the same time. And that created sustainability, because I think one of the big challenges for pharmacy is trying to get these inroads and improving patient care. Sometimes folks will go the road of grants and get a grant funded project, and they bring in some resources, they write a paper, and they collect data. The grant runs out, and guess what happens to the whole program? The whole program falls down. So one of the things we wanted to do was create sustainability. We wanted these programs to survive and grow. So, we had very astute CFOs in our organization. They're like, no margin, no mission, right? So we had to make a sustainable program, have the funding come in so we can secure those positions to provide those services. And by providing those services, really drove improvements in the programs. And that's, I think, one of the keys when you look at doing this type of work in an organization.
So it's interesting you talk about, and by the way, I have a serious ton of questions to ask you. I haven't even gotten to the questions I really wanted to get to, but this is just such a fascinating conversation. So I apologize, I'm going in like a few different directions, and we haven't gotten to some of the other ones. But let me ask you this question. I worked in a hospital pharmacy for 20 years in a variety of different hospital pharmacies. And one of the things on the ground, this is what it feels like. It feels like, and I'm not telling you something you haven't heard from several pharmacists, it always feels like decisions are made in a way that makes management look good, but don't have the resources on the ground. And I'm gonna. And the other decision the other stuff that's happening right now is the use of metrics. As someone who was senior leadership, in many ways is senior leadership, do you think, and I'm gonna put words in my own mouth, do you think pharmacists complain about change more often than they should? And or is it more that it's just change is difficult and that's just growing pains? And how do you sort of respond to pharmacists who say these things to you?
Well, one of the best things I felt I did as a leader, and I think good leaders do, is to be present but not be a micromanager, right? So it's hard to lead people if you don't understand what's going on in the areas and the departments and the organizations that you lead. So I think really effective leadership is to do the rounding and hear the input and talk to frontline people. I was a frontline pharmacist for many years. I was an ICU pharmacist for years, where I rounded on patients and said, if they only got us more FTEs, if they only gave me a better computer, like my laptop doesn't work half the time when I turn it on. So, remembering that, I think walking in other people's shoes is very helpful and to form a better leader. When you talk about metrics, I did use metrics, and you have to be careful with metrics. You can almost have them say anything you want them to say, right? So what I learned, though, in my pharmacy career is I used to go to, I pull ASHP metrics and other metrics that, me and my fellow pharmacy leaders felt were important. And I went up to administration like, I don't even know what ASHP is. I'm like, I don't look at that metric. So, one of the first things you need to do is agree on metrics that will be believed and worked on by the organization, and then try to make sure they're accurate, right? So as a leader, that's what you want to look for. But far as, FTEs and resources, I don't think I've been into or visited a hospital that has told me when I walked in the door, Tom, we have so many people that we just don't know what to do with them, right? I got too many pharmacists, I have way too many techs, and I'm challenged by that. I think I need to get rid of some people. Nobody's ever said that to me, ever. Now,
I've worked in two hospitals where that was true, to be honest. They really had too many. They really should have been firing people. But that's besides the point.
But it is perception is reality, and your personal experience dictates some of those things. So that's where the right metrics can be helpful in working with an organization. I have to say, some of my recent organizations, my most recent one that, I was there with COVID, lean organization, margins are tight. And I think being in a senior leadership position is a little bit different than being a manager or a pharmacy or even a director of pharmacy. You're very close to it, and you feel like an us and them. It's like I kind of convince them to get more. When you sit in another seat, and the first time I did that was a few years back, where I became an executive over a hospital medical center within our health system. So I ran pharmacy, IT, respiratory therapy, lab, all of imaging. And everybody's saying the same thing. That's the first thing I realized, right? Man, no, it's not just pharmacy. Like, everybody feels they're understaffed. So the part of the administrator or the hospital leader is they're getting these requests from everybody, right? So it's like almost with children, like, which one of your children do you say you love more, right? I love all my children equally, right? I'm sure every parent that's listening is thinking that, but there are some favorites, though.
So, that's nursing, right? Just to be clear, it's nursing and surgery.
Nursing could be a favorite. No, and I some of my best colleagues in my career have been nurses and nurses.
Oh, without a doubt.
Right?
Without a doubt.
Always at the table. Every time there was a problem, it felt like nursing and pharmacy was there, and sometimes we didn't see anybody else. But I have to say, I think, the challenge is, as a leader, if you're a pharmacy leader, ask for the things you really need and don't over ask, right? Because then nobody will listen to you as a leader. So you have to be, manage it correctly. And data speaks volumes, so you can have your personal opinions. You can add that as color commentary, say, like if it was like a sports thing, you can add some comments, but if it's not built around solid data, and I think that has become one of the most important things in healthcare organizations, and especially pharmacy today, having data back up what you're saying, helping you make good decisions. It was one of the most critical factors for us to grow our business, like we did at that center in Boston, was really getting data, turning it into information, and having us make good decisions from it, and then using it to measure the decisions that we made. That became very, very, very effective and important for us. And what happened, though, with that is it's like a rising tide raises all ships, Darshan. So as pharmacy overall started doing better, we had more receptive conversations about sides of our business, like the hospital side, that was always challenged with resources to get some of those resources, versus just going at it like we just need more hospital resources and not having other drivers to help the organization. So
yeah. So first of all, I usually end these, as I told you, about 15, 20 minutes. We're already at 28 minutes, so we're well past where we should be. But I'm going to ask you one more question, just so we can finish this thought out. I'd love to have you on again, just so we can have more conversations. But let me ask you this one question. Right now, when I talk to pharmacists, the big issue is burnout. You talk about the advantage of metrics in convincing people, as you put, rising all ships at the same time. But do you feel like metrics, as you said, it depends on which metrics you use, because you can make metrics say almost anything you want. But do you feel like in some organizations, people use metrics to work their pharmacists so hard that it's easier to just quit? Because you're seeing a lot of that happen as well right now, where pharmacists are just saying, I don't have anything lined up, but I'm just going to quit.
Yeah, I mean, again, it's the challenge of one of my biggest things when I went in is to make sure we did no harm, right? So if you're not staffed at the right levels, the chances of you making an error or needing a pharmacist who's a lawyer to talk to become important factors. So I think it is difficult. Some of it is the nature of the beast. Right now, there's a huge shortage of pharmacy techs out there. The huge demand for that. Pharmacists supply is a little bit better. And so the pharmacy techs that are there, if there's turnover and people leaving and they're working more and more hours and they're trying to communicate that to leadership, and is leadership listening? And I'm talking about different layers of leadership too, the pharmacy leaders and then the leaders above pharmacy. And if those people feel like there's no light at the end of that tunnel, there is no ability to drive change, and it doesn't matter how hard I work, either I'm not rewarded or I don't make a difference, or we're just not staffed right, they're just going to get burnt out, right, and leave. So people will always do more for short periods of time as long as there's good plans in place and they feel that people are listening and they're going to drive improvement and change. But, if the organization's not responsive to those concerns, or at least having dialogue on those, then I think those organizations can be in trouble. So it depends where that disconnect is. I've seen pharmacy leaders who think they're fine and their departments are really tight, but they're doing that to make their boss happy because their boss is looking for savings in the organization. So it's knowing when to push, right? As a pharmacy leader, like, do I want to push on this or not, right? And so there's a lot of dynamics to answer that question truthfully, but I think the challenge is that organizations have tighter and tighter margins today. That truthfully, hospital leaders would love to give most departments the resources that they need, but they can't. And it's almost like they have a lifeboat with limited seats, and they have to pick who's going on the lifeboat. That's sometimes what the decisions are in senior leadership and administration, and it's not what those leaders want to do, but it's what they have to do. So it is a balance in that. So it's not like I just want to point to everybody as evil that works in senior leadership. But it is then like, well, then how do you get those limited resources that are available? And I think it's a lot of pressure on the pharmacy leader to do that. It might be putting leaders that before just had to manage the day-to-day and not these complexities of leadership and politics and relationships that exist in organizations to get these resources. So, it's not a simple answer to that question, because I think if it was, there would be no burnout, right?
Yeah, absolutely. No, I think it's fascinating because it's one of those things where I feel like you hear about pharmacists burn out all the time, and you hear about leadership, but I feel like the voice of the leader is not heard as often, and the challenges that a leader faces not heard as often, and it's just one voice. Even though it has a oversized impact, it's still just one voice. So a forum like this I find fascinating because I get to talk to that leader and hear a different perspective from the one I always hear, and learn something more from that discussion. So again, thank you so much for coming on. I do have a couple of questions for you before we continue. Is that still okay? Do you still have a few minutes?
Yeah, sure do. Go ahead.
So the first one, how can people contact you?
Probably the easiest, they can either go to our website. I've seen even splashing that on the page here. So hcihealthcare.net. You can also email us at info@hcihealthcare.net, and those messages will get to me.
Perfect. Here's another question for you. What would you like to ask the audience?
I think, if at the end of this, hopefully it was useful discussion and hopefully they learned something. So if they learned something or they want to make a comment or shoot me a question, that's what I would ask the audience.
Perfect. That's perfect. So what is something you've learned in the last month?
I don't know. There's a long list. If you ask my wife, it changes daily what I learned the last month. I think never take for granted what you have today.
Interesting. I'm not going to ask, but I'd love to know more about what caused that thought process, because it sounds like a lot of changes in the last month where you kind of had to go.
I think just a general thing. I think in life, I think sometimes we take things for granted and we don't celebrate the things that we have.
Fair enough. What's something that made you happy in the last week?
What made me happy in the last week is that it hasn't snowed yet. And it's actually been pretty good weather, so that's going to be pretty happy, though. That's for sure.
I hear it's going to start snowing pretty soon, though, right? They talk up and down, but we'll see.
Well, you know what? I do ski. I took it up when I turned 45. Late in the day. But now my whole perspectives of winters have changed. So as long as it snows on the mountains and not at my house, I'll be happy.
I tried skiing probably about 10 years ago. I tried to do it a couple of times. I used to be a fighter. I used to be a nationally ranked fighter. And I'll tell you, I fell more often in an hour of skiing than I did in my entire fighting career. So that tells you, I was like, this may not be for me. There might be a reason why not too many brown people ski, but that was my experience. It was a painful experience, but it was great. And I'm glad you started and you haven't had that experience. Last question. What's something most people don't know about you?
Average fisherman, love the outdoors, and actually did some NASCAR driving school stuff in my life. So usually not somebody in New England that is like a big NASCAR fan, but one of the things I did when my kids were little is I sent them for a driving school and drove like a Winston Cup NASCAR back when they called it Winston Cup. We're on a racetrack for a little while. It was a lot of fun to do some of that stuff. So
was it the driving and the joy of being on the track, or was it about watching people drive really well? Like, what is the joy of NASCAR? Because it feels like they're doing the same circle like a billion times.
Like people just drive around in a circle and it's pretty boring.
Yeah.
Right? So I've always enjoyed cars. I grew up working on cars with my older brother. And when I got behind the wheel to do it, the best way to describe it is taking an exit ramp off the highway going about 150 miles an hour. That's kind of what NASCAR is, driving a car like that. Is the faster that car goes, the better it handles. And because you're going so fast, you're going down the straightaway so quickly, you're always in turns. So there's a lot that goes into it that's like not appreciated, right? So I got to learn that and appreciate it a little bit more. So it's not just people driving in a circle. Like, so people look at it, driving in a circle. What's so hard about this sport?
That's why I was asking that question. And so I feel like I'm missing a lot of nuance that someone who drives a car at that speed would really enjoy and understand and learn from. So, Tom, this was wonderful. I do hope you'll consider coming back. This was a lot of fun for everyone. I can already see some people sort of coming on and seeing some comments. So this was awesome. And I hope to have you on again.
Love to do it. Just let me know. Happy to.